Hey guys, we are doing another Respiratory 2160 video. Today we are going to, in this video, we are going to discuss inline MDI usage, inline SVN usage, and the Aerogen for when we need to administer some type of aerosolized medication to a patient that is invasively intubated and on a mechanical ventilator. This is a pretty common treatment that happens, especially if you have a patient such as a asthma or COPD exacerbation. The administration of bronchodilators and inhaled corticosteroids can very much benefit these patients, or patients that are having restrictive lung issues, or patients with a history of pulmonary disease. So we're going to show you both MDI and aerosolized. We're going to start with the MDI. So we have the Puritan Bennett 980 here with us. I'm going to show you, this is one of our inline MDI spacers. Let me show you the bits to it. So it's going through the end. This is a chamber, an internal chamber. This has springs in here so we can collapse it so that we don't have the little clips. So that it can collapse and not cause excessive dead space in the circuit. You just undo it by unclipping when you are administering a medication. Maybe. Sorry. Yes, things like that happen all the time. Okay, this is the part closest to the patient. This is the part furthest from the patient. And then this will allow a reservoir to allow for more medication to enter into the patient's lungs and less to attach to the equipment. Up here, you will see this little white piece. What it does is it seals it off to keep the area not only sealed but also clean. You can pop, there are two sections to it. You can see the two loops. Pop the top one off, and that allows one type of manufacturing MDI. So this is universal. You can use it on basically all meter dose inhaler medications. There's a few specialty ones, but the basic Symbicort, albuterol, Ventolin, any of the major brands, this will universally fit. So if it fits in there, there's a little hole in which you will take the MDI canister, match it in there, and push down to actuate for the patient. If that piece doesn't fit it in, you can take this next piece out and it'll cause an even bigger seal canister. You can fit your MDI right into that little hole in order to administer the medication. And then close it off when you're done. So on the circuit where you would place this, remember, blue is inhalation, white is exhalation, and this is the Y. We would take the spacer, this, remember how we said this is the end closest to where the MDI is, where the MDI will be actuated, further from the patient. And this piece of the Y closer to the patient. And we always place any type of inhaled treatment in the inspiratory limb so that the patient will receive the medication. If you put it on the expiratory limb, it's just going to exhale. The patient will get absolutely nothing. So we have this on our inspiratory limb. We can administer our medication, and then we can collapse this to prevent rain out, dead space, and also just general space for your patient. This is so that we can administer an MDI without breaking the circuit every single time. So that's an inline MDI inhaler. Let's say we have an aerosolized medication such as an SVN we need to administer. There's this adapter. It is called a spring T or a T valve. Different companies and different hospitals will call it different things. This is the spring T. As you can see, it goes straight through so that we allow airflow. In here, there is a valve. That one pushed up. Here, you can watch from the inside. That one pushed up. It will open up to allow that aerosolized medication to enter into the airway. This will be administered by an SVN. Again, we have our inspiratory and expiratory limb. This will fit right before the Y. So then we take our SVN, instill the medication into the cup, insert it into the spring T valve, and then start our nebulization at 7 liters. You do not want to do a vent check while running a spring T adapter to your patient, because it's going to change the volumes and the flows being administered to your patient. So do not do your vent check while you're running. Do it before or after you're done administering the medication. Okay, this medication's done. We're done with it. We take it out of line, put it in a clean space so that it's clean. Take this little cap and see how it fits right on top. This allows just another barrier in which to keep your circuit clean and prevent any type of pneumonia or infection transferring to your patient. That is the spring T adapter. Okay. The last one I'm going to show you guys is called the Aerogen. I love the Aerogen. It is this little cup here. Has a little closure right here that you open up. And you instill the medication in here. There is a mesh nebulizer in there that will nebulize the medication. It comes with this T-piece, which you pop the cap open and you can fit the cup in here in the T-piece. Always do your cup up, otherwise your medication will fall down. You will put it on the dry side of your ventilator heater. It should fit right in and then right on top here. So ideally best practice is to humidify aerosolized medications before it comes to your patient. So if you guys do see this by chance, I have seen some RTs try to put nebulizers over here for patients. So anywhere within the inhalation side is best, but since that spring T best fits up at the Y, that's where most commonly you will see it. But it is best practice to humidify aerosolized medications before invasively administering it to your patient. So that's why we put it on the dry side of the ventilator with the cup up. The Aerogen cannot run without this little adapter, and a lot of the time you'll also hear it called an Aeroneb or Aerogen. How it works is one piece connects to electricity, the other has this little adapter like this. Oh, focus, there we go. That goes right in this little box on the Aerogen. Plug it in there, and then you push this button to make it start. Sorry, I don't have it plugged in, so it'll say on or off, and you can tell that by the little light here. And then it will either run for 15 minutes, or if you hold it down, it'll go to the other length of time, the 30 minutes. Or there will be times you will set up continuous, and it will just continuously nebulize until you shut off the equipment or break it down yourself. Be careful with this. So I love these AeroNeb cups, these Aerogen cups. Just be careful with some of the stickier medications that will gum up the mesh nebulizer and it will pool up in the cup. So a few ways you can remedy that is you can just take a blunt tip needle and a syringe and blow air into it. You can kind of poke it a little bit, switch it out, or if you're super classy like me, just kind of smack it until it starts working. That is Inline MDI, Inline SVN, and Inline Aerogen. If you guys have any questions, let me know. And that's it for this video.